Hi, welcome to all. This presentation is on purpose of education and training for nursing personnel in Maternity and Children's Hospital Ahsa. In this lecture, I am going to talk about general guidelines of COVID-19. As of now, COVID-19 infection is a global concern since it is spreading all over the world so rapidly, causing deaths to many. In this situation, all must be aware about this global pandemic and its prevention. Let us see in detail. Coronaviruses are a large group of viruses that can cause various types of illness, ranging from common cold to fatal conditions like SARS and MERS-CoV. And the latest one is COVID-19. Okay, now let's see more about COVID-19. As I have mentioned before, it's a viral infection caused by a positive single-stranded RNA virus called novel coronavirus, which is a new strain of coronavirus first identified on December 2019 in Wuhan city of China. Now let's move on to the signs and symptoms. It can vary from mild to moderate and from severe to critical, and it's totally based on the patient's health status and immune level. But some people are totally asymptomatic, which means to say that they don't have any symptoms. As of the current studies, most of the patients come with dry cough, sore throat, shortness of breath, fatigue, muscle pain, headache, and fever more than 37 degrees Celsius. While others also can come with certain gastrointestinal symptoms like nausea, vomiting, abdominal cramps, and diarrhea. However, in most of the triaging areas, people check your body temperature along with some history collection to make a further decision. At the same time, if a patient is in critical state, you can see that the patient might develop with pneumonia or ARDS, that is acute respiratory distress syndrome. Here the patient can have severe lung damage and inflammation. Because of this, fluid builds up within and around the lungs, causing further infection, which leads to septic shock, major organ failure, and eventually the death of the patient. Okay, now we are going to see who is at risk of getting COVID-19. Actually, many of us are exposed to this virus, but some people are really prone to get this infection than others with high symptoms. So if a person is old, that is his or her age is more than 60 years, they have a more chance for COVID-19 than others because their body system slows down already. The next category is immunocompromised people like cancer patients, people with HIV/AIDS, people who have chronic diseases like diabetes, hypertension, chronic lung diseases, hepatic and renal failure, and the one who is on hemodialysis. Meaning to say that all people with low immunity have a high chance to get this viral infection once you expose with this virus. Further, we are going to see the mode of transmission of this disease. Since it is a new disease, we are still on process to learn how this virus spreads. But as of the current studies, the viruses are mainly spread from person to person by direct contact and by respiratory droplets. Let us see in detail about the contact transmission of this disease. First of all, there is a possibility that the virus can transmit by shaking hands, hugging, kissing, or any other means of direct contact. Secondly, the infection can spread while you touch a contaminated surface or an object that has a virus on it. Then accidentally you touch your face, mouth, eyes, and possibly your nose. Then the next transmission mode is through respiratory droplets. When a person coughs or sneezes, droplets can be produced. It can be land on the mouth or nose of the people who are nearby, and at the same time it can be inhaled into the lungs. Even though the people spread their infection to others while they have no symptoms, people are thought to be more contagious when they are more symptomatic. That is, at their peak level of symptoms, they can transmit the infection than when they are symptomatic. Here we will discuss about what kind of samples we collect and also what lab tests we do to diagnose COVID-19. Usually we collect samples from upper respiratory tract and also from lower respiratory tract. The sample from upper respiratory tract involve both nasopharyngeal and oropharyngeal swabs. But if the patient is critically ill or intubated, we can collect lower respiratory tract samples like endotracheal aspirate, bronchoalveolar lavage fluid or sputum. Then the collected swab is sent to the lab in VTM tube, that is viral transport medium tube. Now let's move on to the COVID-19 diagnostic lab test. It is called RT-PCR test, that is reverse transcriptase polymerase chain reaction test. So this test should be done until there are 2 consecutive negative results. To be more clear, 2 samples should be sent to the lab in 2 to 4 days interval, and both the results should be negative to say that the patient is free from COVID-19 infection. Now let's move on to the case definition. Generally, the patients can be classified into suspected case and confirmed case. First of all, let's see about the suspected case. If a person comes with fever and with any of the respiratory signs and symptoms like shortness of breath or cough, healthcare worker will search for any of the epidemiological link. Normally, the epidemiological link is classified into 3. The first one is the one who has a travel history to any of the COVID-19 infected countries like China, Iran, or any other countries where they handle COVID-19 patients. Secondly, or the second epidemiological link is the one who had a close contact with confirmed COVID-19 patient. So here let's see what is this close contact. If you are taking care of a COVID-19 patient in a hospital or any other healthcare setting, you are considered to be in close contact with positive COVID-19 patient. Then if a person is sharing the same living environment, it can be your home or hostel, with a COVID-19 confirmed patient, is thought to be in close contact. Lastly, if you are traveling with a COVID-19 positive patient in any kind of transportation, you are considered to be in close contact with that patient. Moving on to the third epidemiological link. So if a person or patient is coming with fever and with any of the respiratory symptom, we will ask whether they are working in or visited a hospital or a healthcare facility where COVID-19 cases are getting treated or admitted. If so, we will consider them as a suspected case. Then the last category of suspected case is with no epidemiological link. Here the person come with fever and with any other respiratory illness without having any underlying cause. That means the person's condition is getting worse and worse day by day without any underlying cause. Now the patient needs the hospitalization. Coming to the confirmed case. So if a person is with a positive RT-PCR test or a positive COVID-19 lab test, he is considered to be as a confirmed case. In this category, the patient can be with or without COVID-19 symptoms. Moving on to the isolation precaution. If you are taking care of a suspected case or a non-critically ill patient, you have to follow a contact and droplet isolation precaution. While for a critically ill patient or for an aerosol generating procedures like suctioning or intubation, you have to follow a contact and airborne isolation precaution. So make sure that during airborne isolation, you have to wear PPE with a N95 mask. Let's see about the available treatment for COVID-19. Unfortunately, there is no specific treatment or vaccine available for this particular viral infection. Instead of that, we follow symptomatic management and also preventive management. So prevention is always better than cure. So now let's see how can we prevent the spread of infection. First of all, we have to follow a strict compliance on hand hygiene. It can be done by hand rub or hand wash with soap and water. In addition to that, you can wear appropriate PPE based on your need. Then you have to follow cough etiquettes. This is to prevent or limit the spread of respiratory droplets and to protect others from infection. For that, you have to cover your nose and mouth while you are coughing or sneezing. Some of the current studies says that the virus can stay on various surfaces for a certain period of time. So it is very important to have a proper environmental cleaning and disinfection to destroy the viruses on the objects and surfaces. Well, if you are using a shared equipment for your patient, make sure that you are properly disinfecting those equipments with 70% isopropyl alcohol to prevent contamination and cross-infection. Avoiding crowds and keeping a social distancing will help to reduce the community spread of this infection. In this context, our governments are making various measures to limit the crowd and to have a social distance between people. And also, as much as possible, keep a minimum distance of 1 meter, that is around 3 feet distance between you and the person whom you interact with. It can be your patient or a colleague. Because the study says that the droplets cannot travel more than 1 meter distance, so keep a safe distance always. Similarly, you have to have a good immunity level to protect yourself to give a good fight with this disease in order to avoid major complications. For that, you have to consume immune boosting and nutritious diet which contains a lot of vitamin C, vitamin A, vitamin D and also other micronutrients. And another main preventive management involves isolation of suspected cases. If we isolate the suspected cases now, that might be our near and dear ones, we can be close to them later. So the main focus of case isolation is to prevent further transmission of disease to others. So, as a conclusion, even though COVID-19 is highly contagious, we can prevent it by focusing on hand hygiene and respiratory hygiene. In addition to that, early recognition of this disease and appropriate symptomatic and preventive management can make a better prognosis than SARS and MERS-CoV. So, here we comes with the end of this lecture. Thank you.